Hi, my name is Jacques, and I'm one of the peripheral nerve surgeons at the University of Alberta in Edmonton, Canada. I was asked to introduce this year's Peripheral Nerve Meritorious Award winner, Dr. Jacques, which I thought was somewhat ironic given the fact that just about everybody in the field of peripheral nerve surgery knows that her reputation precedes her. Her contribution to the peripheral nerve literature and evolution as a field has been unparalleled, whether it be her basic science research, clinical work, or leadership within the field. She completed her neurosurgical residency at the University of Montreal before going on to work with Dr. David Klein in New Orleans. She then returned back to work at McGill University, where she quickly climbed up through the neurosurgical ranks as program director, divisional head, and professor. In the process, she soon became renowned for her clinical contributions to peripheral nerve surgery globally as an active member of the CNS, AANS, DSPN, Sunderland Society, among others. Throughout her career, she was a stalwart examiner with the Royal College of Canada for Neurosurgery, where most residents have some sort of story, memory, or even nightmare of her having examined them. Personally, I first met her as a medical student when I was interviewing at McGill University, during which she grilled me on the intricacies of a complex spine case that I had said I participated in, and in French no less. She has never been one to shy away or back down from a challenge, no better exemplified by her mid-career move from Quebec to the University of California, San Francisco in 2014, where she was recruited to take over the peripheral nerve and pain program. This is where our paths crossed again when I applied and completed my peripheral nerve fellowship with her at UCSF, where she is currently vice chair of the Department of Neurosurgery. It wasn't until this year that I truly understood the extent of her peripheral nerve surgery genius, but also what a kind and compassionate individual she truly is. Since that time, I can honestly say that we've become the best of friends, and I certainly wouldn't be where I am career-wise without her. Beyond work, she is an avid marathon runner, as well as hiker and dog enthusiast, as you can see. She has hiked all around the world and conquered peaks such as Kilimanjaro, Aconcagua, Annapurna, Everest, and numerous peaks in Ecuador and Bolivia. I cannot say enough great things about her, and without further delay, this year's 2024 Peripheral Nerve Meritorious Award recipient, Dr. Jacques.
Team.
Good morning, everyone, and thank you so much, Andrew, for those kind words and very generous introduction. I'd like to start by thanking the leadership of the DSPN for this unbelievable award. I'm really humbled and honored by it. I'd like also to thank the peripheral nerve leadership such as Mark Mahan, Justin Brown, and TJ Wilson for volunteering tirelessly into the DSPN to promote peripheral nerve, but also through a very significant work into the field. So the journey to peripheral nerve has been like a long one, but a very rewarding one from Quebec. Then I was trained by Dr. Bojanovsky, who himself trained under Dr. Spetzler. And for those who are doing pituitary surgery, they all know Dr. Hardy's contribution to the field of pituitary surgery. And he did introduce me to the pioneer of peripheral nerve. And through his teaching, I've been doing this fellowship and learn, again, peripheral nerve in a very special way. Dr. Klein has been like the pioneer in nerve action potential recording and into many different surgeries through the posterior approach as well. After training with him in Louisiana, then I started my career at the Neuro. And that's where Dr. Olivier has had marked my career by giving me the opportunity to serve so many patients, to provide excellent clinical care under his guidance. And then also have the opportunity to meet different students, residents, and be the program director for about 10 years there. And he gave me also the opportunity to have and to serve on different boards for which I'm really, really grateful. Then after that, 10 years after that, I had the opportunity to really be recruited at UCSF under the guidance of Dr. Berger. Under Dr. Berger, I was able to continue that leadership through education, service, and also collaboration. Then with Dr. Berger, I was able to meet several people again, through philanthropy, the John Adams family has given me the opportunity to be endowed and promote, again, peripheral nerve. Through all this magnificent team of people, I've been able to advance the field of neurosurgery by promoting, having a nerve injury clinic, through neuroradiologists that are extremely talented and pioneer in MRI neurography, providing just magnificent images, the electrophysiologists that allow us to do peripheral nerve surgery safely, and then also those thoracic surgeons, very talented people that really help tackle difficult cases. Also through the pathologists and the molecular biologists, we were able to understand better the peripheral nerve tumor mechanism. We've done also pediatric peripheral nerve clinic, and we, through education, clinic, work, operating room, cadaver laboratory, and research, we're able to, again, deliver better care to the patient. Here is Dr. Klein into this inaugural peripheral nerve cadaver and Klein lecturer. The support as well has been, and the resources available has been really a true privilege to work at that level. And here's the anatomist and then the entire team. So with teamwork, we advanced the knowledge of the anatomy, the localization, and we worked in peripheral nerve at the different sites every day, and we become a better surgeon that way with teamwork. On a personal note, I would not be there at all if it was not from Tom. Tom has been my advisor, has been everything to me, and we had been through several adventures, and he's been kind enough to support me in all these adventures, neurosurgery and not neurosurgery, climbing and running. This is my two furry animal, Roxy, who passed, and then Gus, and I really enjoyed the California sky, and I truly I'm grateful not only for this award, but for all the possibility of advancing even further the peripheral nerve surgery field. So thank you so much for this award. I really appreciate that.